Talia. My name is Kimberly Dohnt, and here is task 1.4, the case study of Peter and Mary. Firstly, I'd like to acknowledge the traditional owners, the Ngarrindjeri people, on the lands of which I am recording on today, and I would like to pay my respects to their elders, past, present, and emerging. So the summary of Peter and Mary's journey, I think, clearly demonstrates that they've been majorly displaced from their homeland country, as well as having very contrasting journeys within this scenario. But it was lovely to see that their follow-up care was being able to be facilitated locally to get them back home and minimise this displacement. So just looking at the graph that I've created, I think it's very easy to see that there is quite a difference in the two journeys visually. So if we focus on Peter's journey, it seems quite straightforward that once he had left home and it was established they needed to be seen at a major hospital, through the RFDS, he was able to be flown to Alice Springs and then forwarded on to Adelaide at the FMC for more specialist surgery. And then obviously was able to be transferred back by the same means and then being taken back on the bush bus back home, back to his community. In contrast, Mary relied heavily on third parties to be able to help facilitate her transportation to Flinders to be able to support Peter. Those being the community member, a public bus, the PATS, the Aboriginal health worker, and also the social worker, as well as SAS for the ambulance transfer. I think it's worth significant to note also that there was 15 hours on a bus, which is quite considerable, which I would imagine would cause quite a bit of distress towards Mary, but also for Peter for worrying about being alone during this time and so forth. Also, the only time that they would spend time together travelling was initially when they left home to go to the local Aboriginal health clinic, which was about 10 minutes, and then through the SAS transfer from FMC to Adelaide Airport, which was roughly around 45 minutes. So under an hour was the only time that they were ever travelling together. So Peter's healthcare and the impact of being a member of the Stolen generation, I think it is worth noting that in comparison to other Indigenous people, that members of the Stolen generation already have a marked increase of poorer health and wellbeing outcomes in comparison to their peers. So there would be an ongoing mistrust with white people, and therefore maybe a barrier to visiting medical services to access preventative health care. It is known that Peter has quite a few comorbidities, so to get them tended to appropriately to try and minimise any major event in the future may be inhibited, which in this case has unfortunately happened. There's also a degree of anxiousness and stress related, I would imagine, to the news of having to attend a major hospital, not only for treatment, but that would also require transfer by plane and also to a different state for healthcare. And also, I think it would be reasonable to suggest that there's a degree of loneliness that can be related back to his childhood, as there's a degree of separation from family and worry about travel from Mary being on her own. And if there was any suggestion of family travelling, like a daughter or his daughter, or granddaughters travelling to visit, that they may be taken away as a trauma response. 5 points that I can implement as a doctor. I can ensure that they have access to therapy or treatments and follow-ups within their communities and or on country. But if they do have to come into a healthcare setting, that they have support from the Aboriginal healthcare workers, liaison unit, to make sure there is cultural safety being addressed. And be considerate that good health means different for each patient, and that is subjective. And as a result, that there may be a combination approach with Western medicine and complementary and cultural considerations to be taken in place, like a symbiotic relationship. And lastly, also for family members such as Mary to be able to be supported appropriately, to be able to support their family members who are the ones in the healthcare required support. Strengths and weaknesses of the patient journey mapping process. I think CLIC gives a very clear demonstration and appreciation for what patients and their families are required to do, particularly if they are displaced. It also highlights any areas of friction or breakdown and gives you the tools or the ability to minimise those. However, it's not very sensitive for barriers like cultural considerations or financial implications. It also requires third parties to execute their roles with timely accuracy to give a true depiction of the journey that is being undertaken. And here is just the reference that I referred to in a previous slide. So yeah, so thank you very much for your time.